Welcome to Adapt NCLEX. Message nursing is very important. It's a content concept you have to know for your NCLEX. It play a major role because most of the questions will be risk reduction. And when you master message, your content become broad. That's what is they are pillars of the NCLEX. So respiratory is one of them. Today, I'm going to give you some few questions dealing with test taking strategy and critical thinking about message. Most of the questions will be risk reduction, prioritization. What do you do next? What do you do first? Like intervene. So let me show you. How do you answer question? Which finding is the most concerning from the back? You see, most concerning is a priority. What is the problem? A nurse is caring for a client who is what? Post thoracentesis. That's all. Then you ask yourself, what is thoracentesis? This is the individual lung, his chest wall. He has fluid outside. You put a needle here and you remove it. You basically puncture the lung. What are you going to worry about? Most of the time, we worry about pneumothorax developing into tension pneumothorax or causing bleeding or anything like that. That is the risk management. As you learn every concept, figure out what is the things you should worry about. Every time somebody do thoracentesis, worry about pneumothorax, tension pneumothorax, or they cause bleeding, injury to the vessel. Oxygen saturation of 92. It's not that bad. You already had probably pleural effusion. That's why you did a thoracentesis. And then saturation may drop a little bit. Is that what you should worry about? Diminished breath sound is expected because of the fluid. After you remove fluid from somebody who had fluid pleural effusion and you did thoracentesis, they may have decreased breath sound. It may be simply a little bit of air there that is causing that. But when you see hypotension, tachycardia, it means bad pneumothorax that has developed into tension pneumothorax or hemorrhage. Mild chest discomfort. You puncture the area with needle, they're going to have discomfort. So this is the right answer. Don't fall for this. Decrease is a diminished breath sound. It doesn't mean they have no breath sound. In tension pneumothorax, you don't even have a breath sound on that side at all. So that's the right answer. The client is admitted with asthma exacerbation, which finding require immediate intervention. Once again, buzzword, intervention and asthma. Asthma exacerbation, I don't expect you to be laughing at me. I expect you to be in distress. What do I see? Your saturation will be 92. You're going to wheeze when you aspire. That is the definition of asthma. You're going to use your accessory muscle. I don't like it, but that's what we're given. You're going to you're going to be wheezing, and if there is no wheezing, it's a bad thing. Asthma patient no wheezing, they are tiring and they're about to die. Therefore, this is the right answer. Accessory muscle is not good. Respiratory wheezing is the definition. Saturation not low is okay at this stage compared to the other option. If you're not wheezing, you are in trouble. Which what is the next priority action? And then a client with ARDS, acute respiratory distress syndrome, right, on mechanical ventilator is having a positive and expiratory pressure. PEEP is what keeps the alveoli open. There is a normal pressure that keep alveoli open, and that is 5. If you go above 5, like 10, you double your normal pressure. What is going to create is every time you hear about PEEP, think about what? This is alveoli. Usually, this is the alveoli with the small pressure of 5. If you have pressure of 10, these are big alveoli. It causes pressure in your chest. And the two things you should worry about, hypotension and pneumothorax. The alveoli will burst open. So you have hypotension and pneumothorax. Every time you hear about PEEP, think about hypotension and pneumothorax. And therefore, what should be your priority? Look for hypotension and pneumothorax. And what happened? Drop in your blood pressure. And absent breath sound means they have pneumothorax. What's the next priority action? Fix the pneumothorax. Giving them a fluid will kill them. Notify the provider, yeah, you got to give them oxygen. It's not going to help them. Prepare to insert chest tube. It's going to deal with the situation here. I prefer this, then I call the doctor as you prepare. So this is much better. So this is very important question. It's okay to call the doctor, but in this situation, they're sick. So you need to prepare to insert chest tube. The ABG results will be expected in what? A COPD patient admitted with what? Worsening dyspnea and productive cough. COPD, is a buzzword. I know their CO2 is going to be high, right? They live in respiratory acidosis. So look for an answer choice for respiratory acidosis. That's the key. They're not going to be alkalotic. So therefore, A is gone. Their pH is not going to be normal. Therefore, 7.4 is gone. Their pH is going to be between that and that. But most of the time, the key word is they live in the compensated respiratory acidosis. This is a content I'm giving you. COPD patient live in a compensated respiratory acidosis. 7.3 to 50 and 29 versus 7.328. This is far away from 4. Therefore, this is compensated. And you can see bicarbonate is going up instead of bicarbonate going down. Therefore, that is compensated. What should the nurse do first? Prioritization. A client with what? Pneumonia reports sudden worsening of shortness of breath. I have pneumonia. All of a sudden, I have shortness of breath. Give me oxygen, right? On assessment, the next year diminished. There's decreased breath sound in the right chest, right lower lobe. What are you going to do? Chest physiotherapy, that is not the cystic fibrosis patient. Prepare the client for X-ray. It may help you. Assess for oxidation. You have shortness of breath. You need more information. If you check for saturation, if it's 20, you give them oxygen, you get the chest X-ray, you notify the healthcare provider. A client with a suspected pulmonary embolism as a sudden onset of chest pain, dyspnea, and hemoptysis. Which diagnostic test should the nurse anticipate? It's a pulmonary embolism. You don't have to make it so hard. Think about it. Pulmonary embolism. That means something has gone to your lung. So you got to take a picture of your lung. ABG does not give you a picture of your lung. D-dimer is suggestive, but it does not take a picture of your lung. X-ray may look at the bone, but this is the best way to look at your lung. And that's how you can answer this question. Which condition could contribute to this ABG finding? Select or apply. And this is caring for a client with respiratory alkalosis. Respiratory alkalosis means your respiratory rate is high, you're hyperventilating. That's all. You are hyperventilating. Which situation means you're hyperventilating? I see hyperventilation here. I'm using it. You see, just one word I'm using to answer the question. No multiple words. Don't think hyperventilation. Bring your content. When you have fever, you hyperventilate. COPD patient, usually respiratory acidosis. It cannot be respiratory alkalosis. Pain, you hyperventilate. You're anxious, you hyperventilate. Don't make the questions too difficult. What is the next priority intervention? That means priority intervention. One of these is the priority. A client with respiratory failure has the following: pH of 7.25 and CO2 is 65 and bicarb of 28. Look at it. And oxygen saturation, PaO2 is 60. That is respiratory failure. 60-60 club. 60-60. What is the problem? I mean, respiratory failure due to what? CO2 of 65. This patient looked like COPD patient. He's in what? Respiratory acidosis with no compensation. Therefore, every time a COPD patient comes in respiratory distress, don't give them oxygen. Don't give them oxygen. Therefore, mechanical ventilation is out. It's the last resource. Bronchodilator is not the initial treatment. They may need it, but not the initial treatment. So that's also out. 100% oxygen is going to kill this patient. They don't need too much oxygen. They need the ability to breathe. Their CO2 is too high. It's taking away the ability to breathe. Therefore, bring it to the level that they will breathe. And you use positive, non-invasive. What does that mean? If you don't know what it means CPAP or BiPAP. So you use a CPAP. or BiPAP. That is the same thing. If you go and take the NCLEX, you see questions similar to this of a COPD patient in respiratory failure, give them a CPAP, BiPAP, or if they use non-invasive, yeah, that's your right answer. Which instruction should the nurse include? A nurse is teaching a client with COPD how to perform pursed lip breathing. What is pursed lip breathing? It's used by emphysema patients to improve their lung functions because of air trapping. To prevent air trapping, they purse breathe. What do? They inhale through their nose, 2 seconds. You want to extend your expiration over the inspiration. Expiration 2 seconds, expiration 4 seconds. So inhale deeply through your mouth is wrong, through your nose. Inhale deeply through your nose is good, 2 seconds. Exhale slowly through your pursed lip, good, your mouth. Exhale quickly is wrong. You keep your lips tightly pursed as you exhale is good. Which device is the most appropriate to maintain a precise oxygen concentration? A client with COPD requires supplementing oxygen. The best means to give oxygen to a COPD patient is to use Venturi mask. Yes, if I want to give you 20%, I can dial it. I have a different Venturi mask that will give you 20% exact. It does not go up, it does not go down. If I want to give you 40%, I use different color of Venturi mask. This is why it gives you precise amount and is good for COPD patient because excessive oxygen for a COPD will take their away ability to breathe, their drive to breathe. Therefore, this one is best. What is the priority lens action? A nurse observes that a client with tracheostomy has increased respiratory effort and audible gargling. I told you these questions are not difficult. Go for the buzzword. That's what the NCLEX question, 1, 2 lines, right? I have tracheostomy, okay, but what is happening? Respiratory effort is increased audible gargling. That means secretion. Therefore, take care of the secretion. If you give this patient oxygen, it's not going to help them. If you notify the doctor, it's not going to help them. It will tell you, go suction the patient. Complete respiratory assessment is irrelevant, right? So suction the patient. The patient with suspected TB is placed in airborne precaution. That means we've done what we need to do for this patient. It's suspected. The word says suspected. I don't know that the patient has what TB. You see how NCLEX is a test, is a board exams, and then they use these kind of words to think how you think critically. If I'm taking this test, this is all I care about. Suspected TB in airborne precaution. That means I don't know if you have TB. I need to confirm it. You see how I answer question? I need to confirm it. Confirmation is a priority. Antibiotic in this situation is not a priority. You may not have TB, right? Suspected TB, or you may have lymphomas, right? So I need to confirm that you really, really have TB. Therefore, infectious control, I know the one who will do it. You, the nurse, you can test the lab. They will give write orders. Your doctor will write orders. So far as suspected, the most important thing is get some caution. Putting the patient N95, they're not supposed to wear anything in their room or outside their room. Therefore, that is gone. Therefore, the right answer is obtain some caution. So thank you very much for joining us. Thank you for watching this video. If you need more, join adapting course. You can join our crash course or you can join our on-demand course. That is a precise, concise way of learning in the very short form. Or you can watch free videos on YouTube. Join us on Saturdays, 3 p.m. Eastern Time or 5 p.m. on YouTube. But this is the content. Or you can just be a member of the channel where you get restricted videos, something like that. This is a respiratory video for members only for the next 48 hours. Then you can join and then you can get released out. But take care of yourself and good luck.